Hello and welcome. Today, we'll be discussing ureteral obstruction, a condition where the flow of urine through one or both ureters, the tubes connecting the kidneys to the bladder, is blocked. Understanding this condition is crucial for recognizing its potential impact on kidney health and overall well-being. Ureteral obstruction can arise from various causes. Intrinsic causes originate within the ureter itself. These include kidney stones, the most common culprit, as well as blood clots, ureteral strictures which are narrowings of the ureter, and ureteral tumors. Extrinsic causes, on the other hand, are external to the ureter, compressing or kinking it. These include tumors in adjacent organs like the uterus, colon, or prostate, enlarged lymph nodes, pelvic inflammatory disease, retroperitoneal fibrosis, and even pregnancy. When a ureter becomes obstructed, urine backs up into the kidney, a condition called hydronephrosis. This increased pressure can damage the delicate tissues of the kidney. If the obstruction is prolonged, it can lead to permanent kidney damage, including scarring and loss of kidney function. The severity of the damage depends on the degree and duration of the obstruction, as well as whether it affects one or both kidneys. Complete obstruction can lead to rapid kidney damage, while partial obstruction may cause more gradual, but still significant, problems. The exact prevalence of ureteral obstruction is difficult to determine due to the variety of underlying causes. Kidney stones, a major contributor, affect a significant portion of the population, with estimates suggesting that around 1 in 10 people will experience a kidney stone in their lifetime. Other causes, such as ureteral strictures or tumors, are less common. The demographics affected those also vary depending on the underlying cause, with kidney stones being more prevalent in men, for example, while pelvic masses causing extrinsic compression may be more common in women. The symptoms of ureteral obstruction can vary depending on the location, degree, and duration of the blockage. Common symptoms include flank pain, which is pain in the side or back, often described as a sharp, cramping pain that may radiate to the groin. Other symptoms include nausea and vomiting, blood in the urine, frequent urination, painful urination, and urinary tract infections. If the obstruction is severe or prolonged, it can lead to decreased urine output and even kidney failure. In some cases, particularly with slow, developing obstructions, there may be no noticeable symptoms until significant kidney damage has occurred. Diagnosing ureteral obstruction typically involves a combination of medical history, physical examination, and imaging studies. A urinalysis can detect blood or signs of infection in the urine. Imaging studies, such as an ultrasound CT scan or intravenous pyelogram IVP, can visualize the ureters and kidneys, identifying the location and cause of the obstruction. A retrograde pyelogram, where dye is injected directly into the ureter, may also be used in certain cases. Renal function tests, such as measuring creatinine levels in the blood, can assess the overall health of the kidneys. Ureteral obstructions can be classified by several factors. Based on the duration, it can be acute, developing suddenly, or chronic, developing over a longer period. Based on the location, it can be proximal, affecting the upper part of the ureter near the kidney, or distal, affecting the lower part near the bladder. Based on the degree of obstruction, it can be complete, where urine flow is completely blocked, or partial, where some urine flow is still possible. It can also be unilateral, affecting one ureter, or bilateral, affecting both ureters. Treatment for ureteral obstruction aims to relieve the blockage, protect kidney function, and address the underlying cause. Initial management may involve pain relief with medications. Depending on the cause and severity, treatment options include observation for small kidney stones that may pass on their own, medical expulsive therapy with medications to help stones pass, and various surgical interventions. These can include ureteroscopy, where a small scope is inserted into the ureter to remove stones or relieve strictures, percutaneous nephrostomy, where a tube is inserted directly into the kidney to drain urine, or open surgery in more complex cases. For extrinsic obstructions, treating the underlying condition, such as tumor removal, is essential. Preventing ureteral obstruction depends largely on the underlying cause. Staying well hydrated can help prevent kidney stone formation. Maintaining a healthy diet low in sodium and animal protein may also reduce the risk of kidney stones. For those with a history of kidney stones, medication may be prescribed to prevent recurrence. Regular checkups and prompt treatment of urinary tract infections can also help prevent complications. In cases of extrinsic obstruction, early detection and treatment of underlying conditions, such as tumors, are crucial. The prognosis for ureteral obstruction depends on the cause, duration, and severity of the obstruction, as well as the overall health of the individual. Early diagnosis and treatment can often prevent permanent kidney damage. However, prolonged or severe obstruction can lead to chronic kidney disease and even kidney failure. Recent advances in minimally invasive surgical techniques have improved outcomes for many patients. Research is ongoing to develop new treatments for ureteral strictures and to better understand the mechanisms of kidney stone formation, which will hopefully lead to more effective preventive strategies.